Sticking with the health theme, it is Women's Health Wednesday, and this morning we are talking about new evaluations for women with postmenopausal bleeding and premenopausal women with PMOS. Lashana Guy is here in studio with a special guest.
Thank you, Sam. Joining us this morning is Dr. Tiffany Guerra, an OBGYN at Carle Health in Peoria. Dr. Guerra is part of a team in Peoria focused on women's health at various stages of life. Can you tell us a little bit about your background and why you chose this field of medicine?
Sure, yeah. Thanks so much for having me. Well, I was born and raised in San Antonio, Texas, so I have to give a shout out to the Spurs, who are going to win tonight. Go Spurs, go. But San Antonio is where I got to witness the birth of my younger sister, which really impacted me and motivated me to pursue medicine and OBGYN. It's the absolute best specialty in the world. We get to be a part of the most important moment in people's lives, and I get to be there for women during their most vulnerable moments, so it's an absolute privilege.
Wonderful. So speaking of those most vulnerable moments, when should women pay attention, especially postmenopausal women, pay attention to menopausal bleeding, that post-bleeding?
Yeah, so first I like to clarify with my patients, did menopause actually happen? So menopause is when you have gone 12 months without any bleeding, without any menstrual bleeding or vaginal bleeding. Now, you can have menopausal symptoms for up to 10 years before menopause actually happens.
Oh, wow.
Yeah. So that can be things like irregular bleeding, night sweats, hot flashes, fatigue. But until you've gone that 12 months without bleeding, that's when we say, okay, you've gone through menopause.
Okay.
Any bleeding after that time period is not normal, and that needs to be assessed by somebody because that can be one of the signs of uterine cancer, actually.
Wow. Wow. So any bleeding at all after that 12-month period is not normal.
Correct.
Wow. Okay. And so are physicians seeing new guidance for patients with postmenopausal bleeding, or?
Yeah, so actually a couple months ago, April 2026, our American College of Obstetrics released some updated guidelines regarding how to assess postmenopausal bleeding. And we are pushing for more than just an ultrasound to assess these patients and encouraging the use of tissue sampling. It's called an endometrial biopsy. It can be done in the office, or we can also do it in the operating room, but it is a really useful tool to help assess and rule out if uterine cancer is occurring. And the reason why we're pushing for more tissue sampling is because we now have data showing that up to 12% of uterine cancers can be missed if you are not doing both an ultrasound and tissue sampling together. And this is especially true for Black women because they, for multiple reasons, are at an increased risk of more aggressive uterine cancers that can be missed with just an ultrasound alone.
And so how are endometrial cancers or cancer treated?
Yeah, usually first we start with surgery. So that is typically removal of the uterus, fallopian tubes, the cervix, the ovaries, maybe lymph node biopsies as well. And then depending on the stage of the cancer, radiation might be recommended, or special medications that can help treat the cancer cells in the body.
Okay. And so are endometrial cancers on the rise, and why?
Yeah, they are, unfortunately, worldwide, and especially here in the United States. The biggest two reasons are because of our aging population, and obesity is increasing in our country. And the way that that works with obesity is that our fat cells actually release a type of estrogen. So over years of having increased estrogen levels in your body that are imbalanced, that can increase your risk of uterine cancer.
Wow. So there's also something related to women who have not gone through menopause yet called PMOS. Can you explain that?
Yeah, PMOS, we actually just renamed it from PCOS. That used to be called polycystic ovarian syndrome, and now we call it PMOS, polyendocrine metabolic ovarian syndrome. And it's actually a good name change. It's a little bit more complicated, but it reflects the multiple organs in the body that this syndrome affects. It's not just cysts on your ovaries, although that is one of the symptoms of this syndrome. But also other symptoms include typically things like irregular bleeding, irregular menstrual cycles because you're not regularly ovulating, increased acne, increased hair growth to your chin or your chest, hair thinning on the scalp is another syndrome. Infertility is also another symptom because you're not regularly ovulating. And we don't really know the origin of this syndrome. We do understand that genetics and obesity come into play with the syndrome. And the reason why this should be managed is because eventually this can have lifelong effects on your body. It can increase your risk of cardiovascular disease, high blood pressure, diabetes, infertility like we discussed. And when you're not ovulating regularly, your estrogen levels are increased. And as I said, over years of having an imbalance of estrogen can eventually lead to uterine cancer.
Wow. So how can PMOS be regulated? Yeah,
so it affects multiple systems, so we also treat it through multiple ways. I usually always refer my patients with PMOS to a dietitian. Nutrition changes are an important way to help treat this. There's actually special diets that can be recommended for patients with PMOS. Exercise, weight loss, and then medications can be helpful to help balance the estrogen. Some hormonal medications can also be used.
Well, thank you so much for joining us today, Doctor. You can catch more 25 News midday after the break.